Hello all, welcome to another video of Emergency Medicine Simplified. Today I will be discussing about the fluid management, just specifically the fluid management in burns during the primary survey. So as you are aware, a burns patient might be coming you to the emergency medicine. Sometimes in the pre-hospital setting, they might have received some fluids, but in some cases it is very difficult to give the fluids in the pre-hospital setting. So once they reaches the hospital, once you're doing the primary survey, it is very important that you start the fluid resuscitation for these group of patients immediately. So we all know there are a lot of calculations all to be done, but that takes time because you need to assess the total surface area of the burns and all. Then you can calculate it accordingly. I will discuss that in the next video. Now it is very important to understand how much fluid boluses that you need to give in the initial phase when the patient comes to the emergency room. So that is very clear. If the patient is less than 5 years of age, you need to give any isotonic fluid. Ringer lactate will be an ideal choice. You have a balanced crystalloid also, that is fine. You have to give for less than 5 years of age 125 ml per hour. So that is the recommendation. For the age group from 6 to 12, that is 5 to 12 years of age, you need to give 250 ml per hour. And for an patient who is above 13 years of age, you need to give 500 ml per hour. So that is the recommendation for the fluid bolus, not the fluid bolus exactly, the fluid management that you need to start off for a patient when you're doing the primary survey. You will be doing the ABCD assessment during that time. And it is very important to understand that there is no need of IV boluses to be given unless and until the patient is in hypotension. If the patient is in hypotension only, in case of burns, you need to give an IV fluid bolus. Otherwise, it is very clear. You need to give a fluid at a rate of 125 ml per hour for a child who is less than 5 years. 6 to 12 years, you need to give 250 ml per hour. And above 13 years of age, you need to give 500 ml per hour. And the fluid of choice is isotonic crystalloids. So isotonic crystalloids is the fluid of choice. Thank you.